Hi, I'm Dr. John Rush, founder of Arthritis Knee Pain Centers. Today, I'm going to talk to you about osteoarthritis self-care tips. As you know, osteoarthritis, or OA, can be debilitating, causing a lot of pain. So here's some things you can do to take charge of your OA pain. Please maintain a healthy weight. If you're overweight, for every pound that you lose, it's like taking 4 pounds of pressure off of your knees. Low impact and regular exercise will help strengthen the muscles around your knees, give you more stability, and decrease your pain. Low impact exercises are things like swimming, cycling, rowing, things that take the weight off of your knees. In addition to exercise, we'd like you to eat a diet that is low in inflammatory foods. Instead, you should eat things like salmon, walnuts, flax seeds, any foods that are high in omega-3 fatty acids. You can supplement that with fish oil as well. At AKPC, we have a fish oil supplement that you can purchase directly from our website. Also, adding fruits and vegetables is a good way to increase the antioxidants that you're taking in. Another important aspect of managing your OA or osteoarthritis is wearing proper footwear. We have a blog about this specifically on our website. Please check it out. It's called The Best Shoes for Knee Pain. It is also important to perform exercises that help with balance. This will also help you prevent falls. Let's talk about hot and cold treatments for a moment. Many of our patients that come in to see us at AKPC have already done this at home. For heat, you can use warm baths, warm towels, or even a heating pad. This will help soothe and relax your muscles, especially around your knee. Patients also try cold therapy. Cold therapy, like ice packs, help to decrease the inflammation around your knee. Kinesiology taping, and I'm sure you've seen this with athletes, can also help the pain around your joint. The kinesiology taping can be used virtually on any joint in your body. All of these tips are good, but none of them are a substitute for proper medical care. Many of our patients come into AKPC already wearing some type of knee brace, but many of them are not that good. At AKPC, we use an unloader knee brace. These unloader braces are designed specifically for you, and whether you have more narrowing on the middle or on the outside of your knee. The unloader knee braces helps distribute your weight effectively. Remember, if you're treating your knee pain on your own, there will be a point at which you can't do that any longer. Please visit our website or call the number on your screen to schedule your no obligation, no charge screening.